Cinnamon allergy. How to find out that we have an allergy. Although it's rare, it is possible to be allergic to cinnamon. Symptoms can range from mild, such as a rash or hives, to life-threatening, as with anaphylaxis. Diagnosis can be achieved through skin testing, and mild symptoms can be managed by over-the-counter antihistamines or, if needed, prescription treatments. The Food and Drug Administration, FDA, monitors spices to ensure their safety and issues alerts in case of contamination. However, cinnamon can be present in consumer healthcare products, such as mouthwash, toothpaste, and fragrances, so it's important to read ingredient labels. Where does cinnamon come from? Cinnamon spice is made from cinnamomum tree bark. Its flavor and aroma come from an essential oil from the bark, particularly cinnamaldehyde. There are two major types of cinnamon, cassia and Ceylon. Ceylon is considered purer and is native to Sri Lanka and India. Cassia is more accessible, originates in China, and is most likely the one you buy in the grocery store. What is a cinnamon allergy? You can be allergic to almost anything, but when it comes to food, most people are allergic to 9 types: milk, fish, eggs, tree nuts, crustacean shellfish, peanuts, wheat, soybeans, sesame. Spice allergies make up about 2% of all food allergies. If you're allergic to cinnamon, ingesting, breathing in, or touching the spice may trigger an allergic reaction. The symptoms of a true food allergy, including one to cinnamon, may include rash or hives, wheezing, shortness of breath and/or coughing, swelling of lips, face, throat, and tongue, diarrhea, vomiting, dizziness, nausea, fainting, tingling or itchiness in the mouth. These symptoms may occur within a few minutes to a few hours after coming in contact with the allergen. Sometimes, anaphylaxis, a life-threatening reaction, can occur from coming in contact with an allergen. Anaphylaxis symptoms may include sudden drop in blood pressure, difficulty breathing, loss of consciousness, shock. Anaphylaxis requires prompt treatment with an epinephrine pen injection and immediate medical attention. After administering the injection, go to your nearest emergency room for medical help. Allergy versus intolerance. Sometimes there might be confusion as to whether you have a food allergy or a food intolerance. An allergy happens when your immune system mistakenly identifies a specific food or spice as harmful. Your body then releases antibodies to destroy the allergen. An intolerance may cause similar symptoms as an allergy, but no antibodies are present. You can still eat limited amounts of an allergen without an adverse reaction. Intolerance symptoms are usually mild and may include American Academy of Allergy, Asthma and Immunology, food allergy, skin rash, itching in the mouth, coughing after breathing in a spice. It's important to determine whether you have an allergy or intolerance because a true antibody reaction can be life-threatening. Other types of cinnamon allergies. Ingesting an allergen like cinnamon is a common way for an allergic reaction to happen. However, other non-life-threatening reactions can occur that still require a thorough evaluation. Contact dermatitis. Cinnamon can sometimes cause a non-life-threatening rash known as contact dermatitis, which differs from a true allergy. Contact dermatitis usually results from the skin reacting to a substance. Symptoms of contact dermatitis are less severe than a true allergy, typically presenting as a rash that looks like a sunburn with redness, peeling, and itching. Avoiding cinnamon and cinnamon-containing products is the best way to treat this rash. Cinnamic aldehyde or cinnamaldehyde, the chemical compound that gives cinnamon its scent and flavor, likely causes contact dermatitis. This is considered an allergen in Europe and is required to be included on an ingredients list if it is present above a certain amount. Diagnosing contact dermatitis can be confusing because the rash can occur a few days after your exposure to a cinnamon-containing product. Diagnosing a cinnamon food allergy. To diagnose a cinnamon food allergy, your allergist can perform a skin test, a painless prick test on your arms or back. A skin test involves pricking the skin with a sterile probe that contains a small amount of cinnamon extract. Results usually come back within 15 to 30 minutes. If cinnamon extract is not available for the test, a blood test can be done, though skin testing is preferable. If you have a positive skin test and had a previous reaction to cinnamon, you are likely allergic to the spice. Your allergist may prescribe an epinephrine pen and provide instructions on how and when to use it. Managing your cinnamon allergy. Unfortunately, a lack of regulations on accurately labeling fragrances and spices makes it difficult to avoid cinnamon. The FDA allows cinnamon to be listed as flavors, spices, or flavoring. If you have an allergy, be vigilant in educating yourself about the foods you eat and the products you use, and talk to your family and friends about your diagnosis. It may help to keep a journal of foods or products that trigger symptoms. Always read ingredient labels so you know what is in your food. For example, a 5-spice blend may contain cinnamon. If dining out, let your waitstaff know about your allergy, and always carry your epinephrine pen with you. If you have contact dermatitis or stomatitis due to cinnamon, avoid topical products containing the spice. This may be challenging, but your allergist can recommend an appropriate skincare routine for you. Topical steroids or other creams, like tacrolimus, can help alleviate inflammation, and antihistamines can help relieve the itch that comes with the rash. Thanks for watching.